Today I am joined by Seth Berge, a true pioneer in making regenerative medicine accessible to both patients and practitioners. Seth is the founder of two great groundbreaking companies in this space. Regenerative Revival, his direct-to-consumer concierge regenerative medicine company, providing access to cutting-edge therapies across all 50 states, which he has been doing for over 8 years. More recently, Precision Biologics, his wholesale and distribution company that has spent the last 3+ years equipping medical providers in top-tier regenerative products, peer-to-peer training, and the operational backbone to build and scale their own practices. Seth has identified the two biggest barriers in regenerative medicine, education and access, and he's built his entire mission around solving them. Seth, welcome.
Good to be here.
Yeah, so this is a partnership that I'm super excited about. So what I want to do, I want to kind of cover a couple things with you today. One, I want to talk about your background a little bit and kind of what sparked your interest in the regenerative medicine space and kind of how you got to the where you are today. And then what I'd like to do is kind of take a deep dive into regenerative medicine as a whole, because there's a lot of misinformation in there. There's a lot of unknown information, and that's one of the big things that we're trying to do inside of the New Me ecosystem is really educate people on
Yep.
a lot of the things that are out there, and then how to get that to market inside of clinics and wellness centers and gym facilities and things like that. So if you want to start off with your background, just kind of give me a quick background on where you started in the regen medicine space, and then what really sparked that passion, because I think there's a lot of parallels as to how kind of we came to be with personal experiences.
Yeah, so I've been in the space since 2018. I got introduced to it probably the middle of 2018. A former business partner of mine actually went to a marketing conference in Florida. I've been an entrepreneur in different fields prior to that, but there was a chiropractor that actually was offering a business in a box with stem cells, quote stem cells, and it's completely different than what I'm doing now, but it was that's what sparked the interest. I didn't know anything, to be honest. I really knew nothing about regenerative medicine, but what piqued my interest, besides the business and the economics and all that, which we can talk about if you want, but I've been an athlete. I've played Division III basketball and baseball. I've never quit playing. I love sports. I live, breathe, eat sports. So I'd heard of like Kobe Bryant, Tiger Woods, these people going overseas and doing these crazy medical treatments. And nobody would, ESPN would just mention it, but nobody would tell you what it was. And I was always just kind of curious, like, man, the future of medicine, these guys are playing longer. So when I got the opportunity to hear about the stem cell business, I was immediately attracted to the idea of, oh, this actually seems like something I'm interested in. I had done financial planning before. I'd done home improvement, direct to consumer sales. It was all fine and dandy, but it's not really all that exciting.
Sure.
Talking about retirement planning or a new roof or insulation or solar. So all that stuff was fine. But I was like, okay, the business side seems to make sense, but also how cool would it be to be involved in this new wave of medicine? And fully, I'm fully admitting I didn't know anything about the science of it, but you start reading a little bit, it's like, oh, this is what Kobe Bryant did, this is what these guys are doing. So that was a big appeal to me. But I always also tell people when they ask me, how'd you get into it? I don't have a sexy story of like, oh, I had a broken arm and I did stem cells and fixed everything. I'm since a user. I've got great stories since then, but it was kind of a business opportunity. And the idea of like, I had a feeling this was going to be a pretty big industry. And it's always good to be one of the first, I think. So that was kind of a neat opportunity there too.
Yeah. Yeah, and it was kind of the last piece of the puzzle with inside of our ecosystem as well, and it was something we've been looking at for some time. And the biggest thing was trying to figure out, how we implement it, because we fell victim to the same kind of thing. Like, how is this practiced in the U.S.? How is it? Because you hear the stories of everybody traveling overseas and going out of country to be able to do this, and it's like, one, how are we able to implement this inside stateside?
Mhm.
And then also, how do we get it to scale? And so we
Yeah.
kind of did our homework and started looking at companies that were out there, and it was challenging, and I was
Yeah.
so thankful to come across you at Dave Meltzer's event. And I was like, this is the guy. This is the one that
Yeah.
we need to hook up with. They know what they're talking about. They have some stick time in the space. and they get it. The alignment, really,
Yep.
everything just kind of works. So speaking of the regenerative medicine side, um, let's go into detail about how regenerative medicine is currently practiced, and we'll talk about how it's practiced first, and then we'll talk about how it's practiced inside of the wellness system inside of the U.S. after.
Yeah. So regenerative medicine, it's the science and study of how to get, basically how to get the body to heal itself without drugs, without steroids, without surgery. So that's the general. It's regenerative medicine it's a branch of medicine, right? How can the body heal itself? So when people hear regenerative medicine, most of the time, 99% of the time, or 90% plus the time, they think stem cells, which is why, you see the got stem cells shirt. The background, because that's the sexiest part of regenerative medicine. So regenerative medicine has been practiced in the United States for over a decade. Um, there is multiple ways that it's been done. It probably started off, and there's still a little bit of this where they're using your own body's biologics, where they extract body fat or bone marrow, spin it down, extract your body's own stem cells and growth factors, and they can reimplant that. That was probably the beginning of the U.S. market was
Mhm.
there. And then the world of biologics, placental tissue, human cell and tissue products that got introduced maybe about a decade or so or more ago. And there's
Yeah.
been a lot of gray area in that space, a lot of supposed legislation. There's different products that have come and gone, but really steady since about 2016, 2017. Providers at their own discretion have been able to use regenerative products, including birthing tissue products, umbilical cord stem cells, exosomes, and it's evolved. Obviously, it started off probably mainly just for pain management, which is still probably the biggest modality, sports medicine, pain management.
Mhm.
That's probably the biggest modality. Now it's expanding big time into longevity, cosmetic and aesthetics. So it's really expanding. We're learning more and more about all the different ways to use human cell and tissue, which, birthing tissue, placental tissue, umbilical cord. So
Yeah.
it's really expanded, and it's still misunderstood. I'm sure we're going to talk about that more. But it's being used. It's like a $10 billion industry. It's expected to go to 30, 40 billion in the next few years. So it's a
Mhm.
really expanding industry, and we're finding more and more applications for it.
Yeah, for sure. Yeah, and we're seeing the same thing. I mean, between, it started off as kind of direct joint injection tissue, and
Mhm.
now you're seeing it where it can be administered via IV. You're seeing
Mhm.
it used in longevity treatments. You're seeing it used in aesthetics and things like that. So it's really kind of starting to move the needle in all those different areas. And so speaking of that, what are some of the common misconceptions that people have as it relates to not only the application of stem cells, but also the sourcing of stem cells? And I know that's an area that you're
Yeah.
pretty tightly tied to between the labs and
Yeah,
else.
let's talk about the sourcing first. There are still people who don't understand where the stem cells come from.
Yeah.
So that kind of goes back, if you do a little history lesson, late 1900s, early 2000s, kind of the Christopher Reeve, the old Superman. He had the spinal cord injury. Then they started talking about stem cell research. And at the time, in the late 90s, early 2000s, what they had discovered, what they thought the only way to get a good, healthy stem cell was from fetal tissue or embryonic stem cells,
Mhm.
which of course comes with ethical concerns, and this country never passed that. Long story short, there was a lot of controversy at that time. I barely remember it. I was in high school, but there was controversy because, pro-life versus
Sure. Yeah.
whatever. So that got banned. Embryonic and fetal stem cell therapy. It's not a thing. So
Yeah.
I spend way more time than I'd like to, but I understand explaining to people first and foremost off the bat, we're not talking about aborted baby parts. We're not talking about fetal tissue, embryonic. It's illegal. It's probably not ethical anyway.
Yeah.
That's not what we're doing. So the source is the first question. And then there's still a lot of people who maybe heard about stem cell therapy years ago where it was using your own stem cells, right? So then people have legitimate questions about, should I be using my own stem cells? I'm over the age of 18, maybe you're over 40, 50, 60. And yeah, using your own stem cells is like putting old parts back in,
In
right?
the car,
So,
right.
so the best, most ethical, safest, most effective way to get these products is from donated birthing tissue. So that's all I've ever dealt with directly last 8.5 years. That's really all anybody's doing all across the world is using birthing tissue. So just take example in a full-term healthy birth, mother's delivers a baby via scheduled C-section. That baby's delivered. She's already consented that the hospital can collect her birthing tissue. So they got extra people in that delivery room. They're collecting that tissue. They're immediately cryopreserving it. And in an umbilical cord for a full-term healthy baby, there can be up to 500 million day zero mesenchymal stem cells. So just to give you an idea of how rich, I mean, that's a lot of stem cells in one cord. And of course, we know that it's not just the stem cells in the cords, there's other things in there too. And the placenta, the amniotic fluid, all that stuff is getting used now and applied for various modalities in the healthcare space. But I always like to start off with, we're talking about mothers that have consented, the baby's delivered healthy, she's had all sorts of medical tests done, and that tissue that would otherwise be thrown away is what they're using to make these products. Totally
Yeah.
safe, screened, very, very heavily regulated by the FDA, the American Association of Tissue Banks, all those guidelines. So sourcing is still one of the biggest, most basic questions that I get, but it's very easy to explain.
Yeah. Yeah, and that's one of the biggest ones that we see come up all the time too. Even just in initial discussions, that's the first question that
Yeah.
everybody has, and it's really just a lack of education,
Yep.
and it's really lack of knowledge of understanding, kind of what all those procedures are and how regulated it actually really is.
Yeah, yeah,
Uh,
the process.
yeah. So talking about the different types of therapies, so there's a couple different materials, or there's a couple different types of products that are collected. You have stem cells, you have exosomes. There's lesser quality products that are available, PRP, biologics, different things like that. Give us a quick little breakdown on kind of what the difference is between some of those different types of products, and
Yeah.
then also the different use cases for those.
Yeah, so we currently manufacture 14 products. We're probably going to move that up to 16 or 17 by the end of the year. They're all coming from birthing tissue, right? So we have probably our biggest used product, and we're going to dive deep here, but sorry to nerd out, but
That's
there's a term in the industry called Wharton's jelly.
yeah,
Wharton's jelly, Wharton apostrophe S. It's named after Dr. Wharton. Something in the 1700s discovered it. Wharton's jelly runs through every umbilical cord. It's the gooey good stuff that contains the most powerful stem cells, growth factors, different types of collagen. There's naturally secreted exosomes, proteins, cytokines. I'm probably missing a bunch of long words. So first and foremost, what we've discovered in the last 4 or 5 years is the richest source, the most potent way to get the body to heal itself is taking the Wharton's jelly, extracting it from an umbilical cord, and implanting that into an area that has damage. So we have a lot of different Wharton's jelly products. We pride ourselves on making the most concentrated Wharton's jelly products on the market. What that means is the way you measure concentration Wharton's jelly is how much tissue weight, how much actual Wharton's jelly are you putting in every vial. So we have we have a 1 ml and a 2 ml vial. They each contain 150 milligrams per 1 ml of Wharton's jelly tissue weight. That's nerding out a lot, but in a 2 ml vial, which is very common for somebody's shoulder, knee, hip, wrist, whatever, or elbow, whatever, we're putting in a whole lot of Wharton's jelly product into that area. The more Wharton's jelly, the more stem cells, the more growth factors, the more cytokines, the more proteins, the more collagen, the more chance your body gets to heal. So we have the most powerful Wharton's jelly on the marketplace. Those are, for acute injuries, for soft tissue defects. Every patient is different. So we have a medical team that it's not a one size fits all necessarily, but we have very, very potent Wharton's jelly products. Joe Rogan talks about it on his podcast. It's the most powerful form of stem cells you can get. All the pro sports teams are using Wharton's jelly. A lot of them use ours. It's the
Mhm.
best thing you can get for healing soft tissue. So we've got really concentrated products of Wharton's jelly. And then we also have less concentrated products of Wharton's jelly at a different price point because you still want a lot of that good stuff for things like cosmetic and aesthetics. Okay. So we also have a Wharton's jelly product that's a little bit more diluted, fits a certain price point where you don't need as much of that healing material for things like aesthetics and cosmetics. People are microneedling into the scalp You can put it on, there's under eye blephs for that. So we've got a range of Wharton's jelly products, but Wharton's jelly contains a lot of stem cells, a lot of other growth factors, collagen. So that's why it's really good in the cosmetic and aesthetic space. In fact, my wife is a before and after model for a local clinic where she got her under eyes done with our cosmetic Wharton's jelly product. It did a phenomenal job filling in in the under eye. So we make a gamut of Wharton's jelly products. Most of them are cryopreserved. We even now make a Wharton's jelly product that is lyophilized, which is like dry frozen, shelf stable. So there's some applications for that as well. So Wharton's jelly, top of the line, and then we also have a bunch of different exosome products. Now, exosomes are naturally secreted by stem cells. A lot of people call them stem cell exosomes.
Mhm.
So the stem cells that we get come from the cord blood, and we can actually isolate just these exosomes. Exosomes are not living cells. They're smaller. They can get into places that stem cells can't. And stem cells are like the worker bees, and exosomes are like the messengers sending out the text messages telling the stem cells what to do. So I know we could break that down as nerdy as we want, but there's a big there's a big place in this space for both stem cells and exosomes, which is why we manufacture 14 different products. So we've got, just like the Wharton's jelly, we've got some exosome products. Our top of the line exosome product, which is phenomenal for longevity, has 180 billion cord blood exosomes in it. It's got peer-reviewed papers, so we use that a lot for people that are really interested in longevity. And then just like the Wharton's jelly, we have lesser amounts for cosmetic aesthetics. We have a lot of exosome products don't need to be cryopreserved. So
Mhm.
a lot of med spas will like a 30 billion product for microneedling, hair, scalp, vampire facelifts. There's a lot of different applications, but we cover the gamut of stem cell Wharton's jelly and exosome products based on which modality you're using it for.
Yeah, and that was probably one of the most attractive things that we saw in talking with you guys was the quality of the product. I mean,
Yeah.
you're talking, a lot of the research that we did, a lot of the material is double what we see in a lot
Yes.
of other applications, which is pretty incredible. And so having that direct relationship with a high quality product was extremely attractive for us in bringing
Yeah.
it in. The other thing that really kind of fascinated me was what you guys have put into education and the
Yeah.
medical team that you guys have, and then what you guys do from a client training perspective and making sure that we as practitioners and as facilities have access to the right medical team for applications, questions, protocols, different things like
Yeah.
that.
Yeah, anybody that works with us has access to one of the leading regenerative medicine doctors in the world, Dr. Scott Martin. He does peer-to-peer calls all the time, and he runs his own practice. He goes on site and does this. So he's one of the he speaks all over the world on how to
Yeah.
use exosomes and Wharton's jelly, biologics, and he's available to any of our clients that use us. So I don't speak too clinically, I try not to because that's not what I do, even though I've got a lot of experience in it. But that is one of the best parts about working with Precision Biologics is you have access to not only Dr. Martin, but I have a medical team too, internally, doctors that have also been in the space, nurse practitioners that have done hundreds and hundreds of treatments. So if you're a new clinic looking to get started, not only can you talk to Dr. Martin, he'll give you a very, very comprehensive view of everything, but you have access to any nurse practitioner of mine that might be local. Sometimes we do on-site training. Dr. Martin does training as well for new providers. For maybe you don't know how to inject a joint. So sometimes people say, "Well, I want to get in this space, but I don't know how to do orthopedic injections." Well, we've got 2-3 day on-site training available for that. Sometimes people maybe used to do it. They're a little bit out of practice. They can do a Zoom training. So we have a lot of different ways where my goal is if you want to get into space, I'm not a gatekeeper. Maybe I've had people tell me you should charge more for what you know. I just don't operate that way. I'm not a gatekeeper with the knowledge or with my resources, and I think it's just such a cool industry. I don't look at other people in the space as competition. It's more collaboration. Now,
Sure.
if you ask me what sets us apart, I can talk about it. But you're not going to hear me crap on anybody in the space because I think most people in the space are trying to help people.
Sure.
It just so happens I've got 8.5 years of experience, and then what's more important is I've brought people with me that are clinically, they can speak
Yeah.
clinically where I can't, and more hands-on.
Yeah, that's what I love about what you built. And that's where a lot of the alignment happens with us is we kind of have taken the same approach. Everybody always asks why, we offer a lot of the services we do to other wellness centers,
Yeah.
right? We have our own footprint, we have our own clinics and facilities. And they're like, well, why would you give that to the competition? And I go, I go, there's so many people that need health and
Yeah.
wellness. I go, if we can help lift somebody up and make them better practitioners in their space and we can collaborate,
Yeah.
that's a much better way of doing it than having all of this isolated
Yeah.
competition that goes on
Yeah.
back and forth. So we're right on board with
Yeah.
that same mentality. So one of the biggest things has been, over time is access.
Yes.
That's one of the biggest questions that people have, and it's always been viewed as historically being reserved just for the elite or pro athletes or top level access, that it's unattainable by the general public. And what I really love about what you guys have built is you built it in such a way that it is accessible
Yeah.
to the general public.
Yeah, it is. And that's the other thing you asked me earlier, the misconceptions. First one was, where did the stem cells come from? The
Mhm.
second one is access. So there's more and more people getting into space, which I think is a good thing. Recently, in the last year especially, which does mean there's even more confusion, more market noise. Um, so that's the other thing I'm passionate about, is explaining to people that it's really not that inaccessible. And obviously, that's what I've been doing for 8 years, is making it accessible. But most people still think you have to go overseas. I hear it almost every day in a conversation with somebody. Aren't stem cells illegal here? Don't you have to go overseas? So first of all, stem cells are not illegal. Biologics products are not illegal. They're just not FDA approved.
Right.
So FDA approved does not mean illegal. You and I know this, of course, but for anybody who's listening, if you take a look at your multivitamin, your peptide, whatever else I mean, there's so many things that you're taking. If you look at the bottle, it says these statements have not been evaluated by the FDA. Well, the FDA stands for Food and Drug Administration. So if you're wondering, short answer, I could get in, I put my tinfoil hat on and talk about big pharma and all that stuff. The short answer is, what we're putting in your body, these products are not a drug. They're completely natural. In the United States, there's something called minimally manipulated. Our products cannot be manipulated, meaning we're not allowed to add or culture expand these stem cells, which means they're safer. We're not allowed to add any like steroids or anything like that. This is literally taking the products naturally, processing a certain way, by the way, under the guidelines of the FDA and American Association of Tissue Banks. They are in their natural state. You can't put a drug patent on it. So that's
Yeah.
why it's not FDA approved. So the foreign marketplace, kudos to them. They've done a great job of confusing the American marketplace and thinking that in order to get stem cells, you have to go overseas. That's just more and more people are catching on that that's not the case.
Mhm.
But then the next question is, of all these people that are doing it, now where do I go? And the thing that I've seen too is, most patients or potential patients don't know the difference between stem cells, exosomes, Wharton's jelly, cord blood. They don't know any of that, and they think, and I've seen so many people say, "Hey, I got a quote from this company. It's $10,000," and I say, "Okay, $10,000 for what?" And they'll say, "Well, I don't know." And then I'll say, "Well, let's see what product." They don't even know that most clinicians don't even, or clinics or doctors do a really poor job explaining exactly what it is. Because what we talked about earlier, I know this is kind of insider baseball talk, but 70 milligrams of tissue weight of Wharton's jelly, the top of the top stuff, 70 milligrams in a joint is not the same as 300 milligrams in a joint.
No.
Most patients won't know, they don't know, and they don't ask to know, and too many providers don't really know enough to know.
Yeah.
So that's the other passion is, again, I'm not a doctor, but I can educate people on 300 is more than 150. It's more than 70.
Yeah.
And there's nothing magical, like in Wharton's jelly, for example. Nobody's Wharton's jelly is better than anybody else's. It's just more of it. You know
Mhm.
what I mean? Because
Yeah.
it comes from the same
The
natural
same.
source. So
Yeah.
yeah, so access is huge. Now, the other side of that, of course, is I built up a 50 state concierge white glove direct to consumer model, and I've got nurse practitioners all over the country. So, we give them pretty easy access, like your living room, if you
Yeah.
want the treatment. And that's been 8 years in the making of building up relationships. But even in that realm, I offer up my nurse practitioners. I don't own them. They're usually contracted. I offer them up to, I know you and I have talked. I said, if you ever have a facility where you need a nurse practitioner, I've got one in the area. I would certainly connect you. And they come in
Yep.
once, twice a week and treat patients. It's good for the industry.
Yeah. And that's kind of what we're trying to build too with the ecosystem of bringing all these wellness components into other facilities. Because that's the biggest challenge that I saw in the wellness space is there's so many fragmented solutions and everybody's really trying to move the needle. But to be a
Yeah,
specialist in all these areas is a real tall order,
it
right?
is.
For somebody
Yep,
that is just trying to practice wellness or functional medicine. There, to be a specialist or to have a team of specialists across the board and all these different modalities is extremely, extremely difficult to do.
it
So
is.
when we set out to build what we build, we said, okay, rather than just putting another wellness solution together, yes, we have our clinics and everything else, but let's build an ecosystem with the top people and the top companies in each of the different modalities, bring the specialists in, and then work with the facilities on how to implement this and be able to backfill where they have gaps in their solution, where they want to bring some of these technologies in, but they don't have the specialty or the specialists on staff to be able to do so.
Absolutely.
Yeah.
Yep. Yep.
Um, so one of the last takeaways, so for patients, what are some of the self-evaluating questions that patients would have to know if regenerative medicine
Yeah.
is something that's right for them?
Great question. So let's just start with the obvious, the pain management, right? So chronic pain, that's the still by far the biggest driver for the industry. People that have been in chronic pain and they're tired of taking NSAIDs or, cortisone shots. Because by the way, cortisone shots, for those who don't know, they might be effective. Obviously, we know they're effective as far as getting you out of pain for the most part, but a cortisone shot is catabolic. It greatly accelerates the deterioration and degeneration of all the soft tissue and even the bone density.
Yep.
So the more times you do cortisone shots to get out of pain and get you through, I'm not blaming anybody for doing cortisone
Sure.
shots, but just know you're accelerating your body's own natural deterioration process. So what the Wharton jelly, the stem cell products do is they actually do the opposite. So start off with thinking, do you have a part of your body that's in chronic pain? And the real sweet spot for this type of treatment is two things. Number one, is there degeneration?
Mhm.
So we started the conversation talking about regenerative medicine, right? The goal of a regenerative therapy is to regenerate. So I know it sounds kindergarten, but you wouldn't need a regenerative therapy if you didn't have a degenerative condition.
Mhm.
So soft tissue defects, things like tears, that's why this is so popular for athletes. You get tears in your shoulder, labrum, rotator cuff, guys that just want to work out. So if you're somebody who's been a gym warrior and maybe you're in great shape, but you haven't been able to overhead press or bench press for years because maybe you've never even gone to the doctor, but you've got tightness or
Yep.
acute pain. That is a sweet spot. We can put our product right into where you have your soft tissue defects. Give it weeks and months. It's going to actually naturally repair that soft tissue. So think joints that have soft tissue, knees, if somebody's starting to become bone to bone, bone on bone, that's a defect in cartilage. Cartilage is soft connective tissue. So if we can put the product in there, get the body to potentially make its own new cartilage, that's a huge thing, of course. Avoid
Mhm.
knee replacement. So knees, shoulders, even in your spine, any disc. So a disc is also a version of soft tissue, degenerative disc, bulging, herniated, ruptured disc. So anything up and down the spine, we do a lot of cervical and lumbar injections. So those are the obvious. And then inflammation. And they usually go hand in hand. If you've got a torn rotator cuff, if you got, torn meniscus, if you're almost bone to bone, you almost certainly probably have inflammation in the area too. So stem cells are some of the most powerful anti-inflammatory agents in the world. So they're actually attracted to inflammation. So where there's pain, where there's inflammation, that is the self-diagnosis. That's the biggest one there.
Yeah.
Pain, inflammation, soft tissue defect. That's the most obvious.
Yeah. And what about for providers? What are some steps that, in addition to doing work with us, what are some takeaways that some providers can have for if they want to add regenerative medicine into their practice? What are some of the steps they're going to be taking for that?
Yeah, it starts. It's very important that so many, and had a couple calls this morning already with potential clinics. Um, there is a demand out there. More and more American citizens are asking their providers, "Do you guys do stem cells or regenerative therapy?" So there's a demand for it first and foremost. So if you're not doing it, you should be, but you got to do it right because
Yeah.
this is still because it's not FDA approved. There's a lot of ways to do this wrong and get yourself in trouble.
Mhm.
If you make claims that sound like you're talking about an approved drug, that's really what the FDA and their big pharma lackeys really don't want. That's really what the big pharma and their lackeys really don't like is when you say things like, we are going to implant this stem cell product and it's going to cure and treat or prevent your osteoarthritis.
Mhm.
Now, do we know that it's going to have a major benefit for their osteoarthritis? Of course, we know that, but language is important.
Yep.
So if you talk about it as if it's an FDA approved drug and you market it and you don't have the proper disclaimers, waivers, consent forms, that's where you can get under the ire of either the FDA, the FTC, or your state board. So part of what we do is, because we've been doing this for so long, is we're going to show a provider how to offer the best possible care, patient outcomes, and do it in a way that you don't have to worry about getting that FDA letter or getting somebody to say, "Oh, you didn't explain it to me right." So we offer consent forms of every kind for every modality. Um, it's very key. It's such a good industry. If you're in the space, you can make there's good margins, patient outcomes are great, but you got to do it right. I've been in this long enough and I've seen companies, it's not even that they were doing their patients wrong, it's just they were saying things
Yeah.
that were too bold or so they're just saying the wrong thing. So it's very important if you're in this space that you partner with somebody that not only just has a product. Anybody can get your product. It just so happens ours is better, more affordable, but that's one side of it.
Yep.
You got to have somebody show you how to run the business in a way that's going to be profitable for you, ensure patient outcomes, but make it so you don't have to worry about getting in any sort of regulatory trouble. And that's what we provide as well.
Yep. Yeah, I love it, man.
Yeah.
So what about for you, man? What's on the horizon for the next, 3 to 5 years? Where do you see kind of you guys heading, emerging therapies? You guys just
Yeah.
tracking, as things progress,
Yeah.
or
I always have my ear to the ground. I think for whether it's luck or whatever you want to call it, I got in early on this space and it's been really good for me.
Mhm.
8.5 years ago. The science of regenerative medicine is rapidly changing. So even in my 8.5 years, our products have gotten a lot better. So
Yeah.
the products that we were putting in people 8.5 years ago work great. They're better now. Wharton's jelly wasn't a thing eight years ago. It was all cord blood, right? So
Yep.
we've known that Wharton's jelly is better for certain conditions. Um, there's some really cool stuff. There's some docs. I don't want to say too much, but they're working on some cancer. Cancer could be a big one. Kind of waiting
Mhm.
for a couple of breakthroughs. Just me, I would like to be on the cutting edge of that for if and when there's some incredible breakthroughs with cancer that some of these
Yeah.
doctors are working on, Alzheimer's, dementia, things like that. We don't really touch that stuff now so much here in the States. There's clinics overseas that will get a little bit more experimental, but there's innovation happening.
Mhm.
And if I continue to do what we're doing now for the next 3 to 5 years, I'll be happy to. Things are
Sure.
great, helping people. The easy answer is I just want to keep helping more people, getting more partnerships, people like you, getting more exposure. That's all great, but it's also kind of I've got my ear to the ground. I want to make sure that I'm part of the next breakthrough. And like I mentioned, it could be pretty big. Alzheimer's, dementia, autism for kids. There's a lot of research going on there. Even things like heart disease, organ regeneration. So there's I as great and as all encompassing as regenerative medicine is now. It's crazy to think about, but we're still in its
Infancy, yeah, for
in
sure.
the infancy. Yeah,
Yeah, I love it, man. I love where it's headed. I'm excited to be partnered with you.
yeah,
You've done a great job building this so far. This has been a great conversation, and you and I share the same belief. In the future isn't of medicine is not about managing symptoms. It's really
yeah,
about optimizing potential and regeneration in
yeah,
people.
yeah.
And that's what I love. The vision is the same as what we have. So we're super excited to be partnered up with you.
Yeah, same here.